Welcome to Homeset, a transitional care management program. We are very excited to introduce to you our newest transitional care technology. The Homeset TCM module allows for the management and tracking of a patient's transitional care and completely supports the Homeset transitional care management process. It starts with the intake. The TCM intake department receives the patient information from the discharging facility, whether it be electronically, through fax or phone, capturing patient demographics, payer information, medical orders, social situations, diagnosis, and discharge documents. The intake coordinator immediately creates the patient file and cues the patient for transitional care management services. Once the patient is in the TCM queue, the hospital coaches receive a patient alert notification and can instantly view the in-facility TCM patient list. The coach then reviews the patient case file along with hospital charts to assure record completeness. Utilizing a mobile tablet or device, the coach visits the in-facility patient to provide them with the coaching process and then proceeds to capture the patient's detailed profile. This is done in a friendly and quick question and answer format. The coach will then educate the patient or caregiver on how to get more involved in self-managing his or her post-care. This may require teachings on simple disciplines to make the patient feel more self-empowered. Within minutes, the information is weighed by the coach, and the transitional care service recommendations are made. A list of interventions and suggested care services are itemized by the coach in the recommended TCM care plan section. Service providers may be selected from within the first-person community care network or option from patient choice, health plan networks, and/or hospital services networks to match needs. A post-care nurse visit and follow-up physician appointment is added to the list by default. After all data is entered by the coach, the recommended transitional care plan is then printed or electronically shared with the assigned case manager for review and approval. The care plan information is neatly organized so that the recommended plan can be approved by hospital case manager or modified within minutes. After the plan has been modified and/or approved, a Care Service Coordinator or CSC team will promptly begin to book the care services using our Vendor Match tool. The Vendor Match tool uses an algorithmic process to identify the patient's payer source, geography, available service networks, and care requirements. Within seconds, it returns a list of qualified vendors able to provide patient services. The matching system strategically places providers within a rotational list to assist with quality control and to ensure in compliance with any anti-kickback laws. In this way, each qualified provider receives an evenly distributed amount of patients, and first person can better facilitate the demand for timely service delivery. Referral tickets are directly assigned to selected service providers. Service providers also receive a referral alert notification to ensure the services are booked as quickly as possible. Service providers have direct access to their service tickets and can, in real time, accept or reject the service request. A CSC will also follow up with service providers to ensure all referrals are booked in a timely manner. The hospital TCM coach receives a notification that the TCM care plan status has been updated approved. A coach cannot continue with the discharge process until all services have been accepted, booked, or the patient has an alternative post-care plan in place. The approved transitional care plan is then printed, presented to the patient, and reviewed by the patient and the coach. In addition, there is a direct contact phone number in the patient transitional care plan for our 24/7 Careline. On the day of discharge, a CSC will place an interactive call to the patient or caregiver to confirm a safe discharge, explain next steps. The post-discharge patient is navigated through the TCM process, monitoring the post-care plan progression and documenting all touchpoints within 48 hours post-discharge. The patient will receive an interactive nurse visit and assessment to review medication and evaluate the level of post-care needed. Nurses can view and coordinate their visit schedule in real time. The TCM module queue filters a today's visit list and organizes any future visits so nursing staff is up to date. The TCM module offers direct mapping to appointments just by tapping on screen. During the assessment, All information is gathered and stored in the patient's profile, including medication lists, progress reports, and/or any modifications to care plan. Once the nurse assessment has been completed, the patient is ready to be seen by his or her follow-up physician. After the physician visit, a CSC will document the outcome of the visit along with any information provided directly by the physician's office or the patient themselves. Post-care follow-up. The TCM module facilitates a follow-up protocol with patient or caregiver. Telephonic health checks are conducted as often as daily and no less than once per week by a knowledgeable and friendly staff of care service coordinators. All phone calls are noted in patient portal, and the next recommended follow-up appointment is added to the CSC follow-up schedule. During the follow-up process, CSC staff will maintain a constant line of communication with service providers to follow the patient care progression and to ensure the maximum level of care. Patient Satisfaction Survey. Upon the completion of a 30-day TCM service, the patient and the CSC will complete a Patient Satisfaction Survey. This survey is then archived and made available alongside the entire noted TCM process for reporting, post-evaluation, or so information can be printed for TC billing purposes.